Okay.
All right, I'm gonna call this Health and Human Services meeting to order. It's May 19th, 2026, 3:45 PM, and we're gonna start with Human Services, Director Almasi.
Thank you, appreciate it. So unusual to be called upon first. I think it must be maybe Melissa submitting a resolution.
Exactly.
Yeah, I want to give credit where credit's due.
Yeah.
So I don't know, what do we have? Quite a few today. Start with financial resolutions, I believe. First of which is to accept money from the New York State Office of Mental Health for student loan forgiveness
I'll move that.
program.
Second?
Further discussion? Good for retention. All in favor?
Mhm.
Aye. Opposed? Carried.
Can I just ask a question? Like, do you have that, I mean, is it, how many folks have you had that qualify for?
I believe the state has rolled this out in several different phases. This may be the fourth phase of it, but if it is in phases 1, 2, and 3, we've got about 3 staff. This gentleman would be the fourth. So not too many, but enough. And they're all receiving the maximum amount, which is, I believe, just under $30,000, 26, 27,000. Is it on there?
Yes.
Okay. Yeah, which is nice if you carry a debt
Yeah,
from your master's degree.
yeah.
Okay, on to financial resolution number 2. So this is requesting your approval and support for opioid abatement dollars to be used to assist Columbia County Pathways to Recovery, our addiction recovery center in Chatham, with the desire to bring somebody on. If you don't know, it's staffed with all volunteers, and they'd like to bring on a paid staff person as an executive director to hopefully invigorate the mission and vision of what they offer the community. I met with the leadership from CCPR prior to bringing this resolution. I'll be honest, they've had their challenges in maintaining the recovery center, getting enthusiasm there throughout the entire day that they're open. They have some evening 12-step fellowship classes, things like that. But the volunteers are growing tired, and they're asking for this financial support. The $7,000, of course, isn't going to cover the part-time executive director. They have funds coming from elsewhere, but they just need a little bit more to round it out. So I ask for your
I'll move
support.
that. Yeah, I will.
Do I have a second?
I'll second it.
Further discussion? They do have some good programming. I'm trying to think, and it was also, as I mentioned before, one of the impetus for that Hudson to Chatham shuttle run was
Yes.
that establishment, because they had to move from Hudson to Chatham.
Yes, which I was told was used initially, but unfortunately the ridership to bring people out to CCPR has dwindled. Hopefully the ridership, is strong in other ways, to support it and justify it. We talked about various solutions, maybe stronger partnership with the Red Door, the men's recovery residents here in Hudson, and bringing those individuals out to CCPR for some of the programming. So pitched a few ideas to the leadership that I met with.
Well, I had a motion in a second. Brenda, you want to?
I just want to know what the $7,000 about. I understand that it's only part of an executive director, but will they have an executive director that's 5 hours a week or?
A very small part of the executive director. I can share the budget that they shared with me with you if you'd like. Total cost would come in at about $40,000, I believe. So they're, allocating the rest through various
Thanks.
sources.
That makes me happier because $7,000 is a,
It's
Wow.
not, nothing.
Yeah, it is.
So the town supervisor's salary.
yes, I was thinking the same.
All in favor?
Aye.
Opposed? Carried. Welcome, Gandalf.
Peace.
I believe we're on to general resolution number 1. This is to renew our school satellite contract with New Lebanon Central School Districts. That satellite, in case you're wondering, is operating on all cylinders, as they say. We're serving appropriate amount of children for the 7 hours that we're out there. And we're in both of the buildings. The New Lebanon School District consists of 2 buildings. I believe it's the high school, and then there's the elementary and middle school is how they split it up. We're not quite at the point where we would want to expand beyond the 7 hours, but I'd definitely like to renew it so we can be there in the fall.
Second,
Thank you.
Further discussion? All in favor?
Aye.
Opposed? Carried.
their
Now,
school,
what other? Oh,
their school superintendent said that they have the highest percentage of children with mental health issues in the county. So I'm sure that's one of the reasons it's well attended.
That's an interesting statement or fact. I don't know how,
He
where they're
characterized
getting
it as
that
a
data from.
Yeah.
Anecdotally speaking, yes, there's a significant need. How it compares to other districts, I don't know. We don't collect
Does the
that.
Department of Ed track that?
How
Just
would
you
that-
and I were meeting him on funding issues, and that was just one of the facts that he threw out. And I'm sharing it because it's a way of testing it. You know, when Dan looks surprised, like,
I'm not surprised that I
I've not
doubt it.
heard
I'm
that
just
before.
surprised that, how would you actually quantify that? Just for example, a
ask
student
him.
learner could go privately to therapy for their
And you'd
mental
never
health
know.
issue and the district would never know.
mhm.
So maybe through, education service plans, which don't necessarily equate to the student having a mental illness. It's a
Also,
tricky
on
number.
the flip side, it could be parents in some place are more likely to flag it and indicate it, and in other places,
Not so much.
that's not happening. So I would actually question that that's actually.
Right. I would argue the need is present in all 6 of our districts throughout the county. I'm grateful that New Lebanon has accepted our invitation to be there. And I continue to work with the other districts to kind of encourage them and make them aware of what we have to offer. And we'll see if that bears fruit in the future.
and we're still holding quite a few hours at Columbia Green Community College, right?
Yes, we have a 35-hour-a-week staff person now.
Okay.
Yes, so on to the next general resolution, which is to ask for your support to appoint a new alcohol and substance abuse subcommittee chairperson.
Move it.
Have a second? I'll
Yes.
second. All in favor?
Aye.
Opposed? Carried.
Third general resolution is to renew a learning agreement between an academic institution, I believe it's Russell Sage College.
Yeah.
We work with many of their nurse practitioner students. We mentor them, proctor them, and in some cases have brought them on as employees. But it's nice to be able to get back. So this is just to renew that learning agreement.
I'll move it.
Second,
Further discussion? All in favor? Aye. Opposed? Carried.
Fourth and final general resolution is in regard to bringing a documentary called Our American Family to Columbia County. We're working with PSL as the venue to show this documentary. It's a documentary about a family, obviously hence the title, that's dealing with addiction, primarily with the daughter who also has a child of her own, and how the mom and the family and the siblings deal with all of that. I've seen it, I've previewed it. It's got a lot of layers to it, a lot of dynamics to it. I think, I encourage, if you're curious or interested in the topic, please, come when we host this. We're also going to be showing it on that day with a panel, and the mom who is in the documentary will be on the panel. And we're also going to offer this at the clinic the following day for all the clinicians to view. So it's being offered to us at, in my opinion, a very reasonable rate.
move
Sorry.
it.
Second. Further discussion? All in favor? Aye. Opposed? Carried.
What's the goal on that?
Goal, increase awareness overall about addiction, family dynamics, family systems. We are still actively working throughout Columbia County to improve people's understanding and sensitivity to all things substance use, whether it's recovery, whether it's harm reduction versus abstinence. In the clinic specifically, you know, we employ all master's level clinicians. However, not all of them have backgrounds in substance use disorder. And over the past years, but most actively the past several months, because COVID is a massive interrupter, we were moving towards providing toxicology screening as a therapeutic tool, not as a punitive tool in the way that parole or probation may use it, as a therapeutic tool to understand what we're treating, what is in a person's system. Are we dealing with depression? Are we dealing with, you know, alcohol dependence, cannabis dependence, etc.? A lot of the clinicians are, I wouldn't say struggling with that, but need further understanding and education. A film like this that drives it home in the way that it does, as well as having the actual one of the subjects of the film, the mom who's lived it, there to speak with our staff in the clinic is priceless.
Awesome. Thank you. Thank you very much.
We'll get through resolutions and I'll go to public
That
comment.
was great, man. Thank
No, we can write as soon as we're done.
That's great.
Let's be done.
Thank you.
We'll just get through these. Go ahead, Dan.
Okay. Personnel resolutions, total of 3 of them, the first of which is to fill a vacant account clerk. This is an important position. It's one of the 2 account clerks that sits at the front window, receiving the folks that come onto our floor. So I ask for your support in filling this.
Is that the
vacancy.
intake clerk? I'm sorry.
Is it miswritten?
Yeah.
Okay,
Is that,
yes,
well, the
intake clerk.
resolution says vacant intake clerk, so I just want to
Okay.
make sure I was on the right one.
Then it is, yes.
Okay.
I'm
I'll
sorry.
move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay. Personnel resolution number 2 is to create and fill a behavioral healthcare coordinator assistant. So this is in our adult care coordination program, which is growing. We currently serve nearly 400 individuals. Mary Jo Berger, the program supervisor, is interested in bringing on a behavioral healthcare coordinator assistant, which comes in at a lesser cost than a behavioral health care coordinator. There's no compromise in what the 2 titles can do in terms of generating the reimbursement that they generate. So I certainly support this, and I ask for your support to bring on the behavioral health care coordinator assistant. And I don't expect there to be a challenge in finding such candidate. We've not run into the same challenges with the bachelor's level that we have at the clinic, where we require master's level and above.
Move it.
Second. Go ahead.
Further discussion?
Ladies at that end of the table.
And just in case there was any hesitation, the expense is offset by revenue.
Mhm.
At the very minimum, right?
At the very minimum, there's usually, you know, a little extra.
That's what it says right there.
So I had a motion and a second. Any further discussion? All in favor? Aye. Opposed? Carried.
Okay, so the third and final is to fill a vacant senior behavioral health care coordinator position, which is also on the adult care coordination team. You may remember last month you supported me in the create and fill of a promotional position. So that individual's been promoted, thus leaving this vacancy. So I'd like to backfill this vacancy that was created.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Okay, that's it for me. I genuinely want to thank you for all of your support in regard to all these, you know, vacancies and create and fills. I'm really pleased with how the programs are performing, and I couldn't do it without your support. So thank you very much.
Well, you've done a marvelous job, Director. Before you get up, I'm going to ask for anything from the committee.
Good.
We do have a member of the public who has a comment germane to a previous resolution equally.
To this effort with the film. Congratulate you, it's wonderful. There was another film, I think it was called The Good Life, that was shown September 18th. That's my birthday, that's why I remember it.
That's impressive.
Kamal Johnson, Jackie Salvatore was there, and it's the story of this woman that was actually happily anticipating getting married, and then had an accident, became addicted to, and her life got ruined, and there's a whole of her significant older generations, so it's kind of movies. You know the movie?
I do. I believe I was there for that screening. It highlights what you're talking about. It's just, you know, that if you think you're not susceptible, life can put you on a twist and turn, series of twists and
And
turns.
she wasn't even to begin with,
Right.
it going down any kind of road.
a lot of people became, opioid dependent on prescribed medication, thinking it could not become habit forming. And that's something we've done a lot of education and information sharing around in our community and, you know, throughout the country, actually, but there's a lot more work to be done. There are still physicians, if you can believe this, that, you know, tell us because they prescribe it, it's safe. Well, their control over the safety of that medication ends when they prescribe it. What the individual does with it is up to them. They can, you know, take more than is prescribed and then become dependent and develop a tolerance and so on and so forth. So the fact that some physicians still believe that is still very concerning, and it speaks to the amount of work that we have ahead of us. But we're still making huge strides in the right direction with regard to, you know, overprescribing and controlled substances and also illicit substances.
Very good. Thank you very much, Director. Excellent. And not too long ago, school children were able to play with nuclear right out in their hands, right?
I did that.
Office of the Aging. Got some good news on here.
Yeah, very exciting stuff. All of my allergies are outrageous, so I don't sound excited, but I am excited. My first resolution for you tonight is to contract with the Columbia County Agricultural Society for September 16th for our 2026 Senior Day.
That's fantastic. I had a motion. Do I have a second?
Second.
Further discussion at a very reasonable rate too. You've secured.
Yeah.
All right, all in favor?
Aye.
Opposed? Carried. Looking forward to that.
Means more Mr. Dingling for everybody. Our second resolution for you is requesting to extend our contract with Oliver Packaging. That's who provides the packages for our home delivered meals. In the contract, which I think I sent a copy of, it had the stipulation, option to extend the agreement for 2 1-year periods.
I think I had it attached, but I don't have it.
I'll move it.
But that says to conclude in 2027, so that is that's it's an inconsistency, right?
Right.
28.
Yes. Yes. Math.
You're welcome. I do that all the time, so.
Yeah, I have a hard time
Yeah.
with it.
Let me tell you, I was just in a rush to get an agenda out before coming down here. Cut and paste, you gotta watch yourself.
So
it's 2 1-year
I think it's-
extensions, so it's
It's a
1 year.
1-year
ends next-
extension,
and then-
and then we
1
would
year
have the option
contract
to
and
do
then you can
one
have
more.
another
Then
one.
we do another
Okay.
one.
If you want to,
So that-
right?
Yes. I
Says
believe.
Is it a contract? It should
So
be
I've
in
got
there.
it in,
then
I've
I'll-
got it.
Do you have it? Is the contract attached?
Yeah, I think so.
Option to extend the agreement for 2 1-year periods upon mutual agreement of the parties. in
So you're
writing.
only exercising the first option, is that what we're doing?
I believe so, yes.
So then
That
it's
is
correct.
correct.
Yeah,
Second
that was
one next year.
And then you come back.
With a maximum contract date of July 2028. So if you want to do just a 1-year extension for now, or do you want to do 2?
Yeah.
Do 1?
Is it-
Okay, then we'll read the resolution unamended.
Yeah.
And then I'll come back next year.
And I had a motion and a second today. I had a
I have a
motion.
motion.
Yeah.
Who gives me a second? Chairman,
Matt, you
second.
made the motion.
I'll do both.
I think so.
There's so much conversation.
It's his lucky day. Do it both.
Somebody want to say?
I'll second.
A second. All in favor? Aye. Opposed? Carried.
Yes, we had a contract with them for a while, and this is the first time we could switch things up, and we're working with central services, so I think that's why that got a little confusing. And then those are my resolutions for you. I just put together a little report for some of the things that have been going on. We have officially received a signed contract for the St. James Church to continue expanding the respite center. We also met with Rojan and Kinderhook. I think I had mentioned Rojan the last time I was here, and Kinderhook Libraries recently, just very preliminary meetings to talk about possibly expanding to there as well. So that's very exciting news. We have had a couple people come through and tour the kitchen, which I also think is really exciting. Our volunteers, this year we invited anybody who was able to come in, and we had an ice cream party because, you know, that's what brings people in. And then a bunch of people walked through the kitchen to get a peek behind the scenes. And they also got to meet each other. We've heard from some of the volunteers that they would really like to be able to meet other volunteers, the volunteer coordinators. We've been putting together some meetings, and they want to be able to maybe kind of use each other as resources. So I think that's coming along nicely. We back in April, participated in the senior, I forget exactly what they called it, community forum, something like that, with the Kinderhook Mayor, Assembly Bendit, and Senator Hintry's office, which I thought had a great turnout. Yesterday, we had a fantastic turnout for our caregiver forum that we did in collaboration with Greene County Aging Services and the Alzheimer's Association. We had, I want to say it was like 32 caregivers show up, which, you know, we were hoping for a big number, but expecting it to be pretty small because it was the first one we had done. But there were a good amount of people there. We had really good feedback from everybody. We've gone through all the surveys yet, but I think everybody involved agrees that we're going to try and do this every year. There was also talk about maybe putting together a smaller version of this on maybe like a monthly or quarterly basis where they're bringing caregivers together. So I think that was really, really positive. New Yorkers Day coming up, a couple community days. We've got a conference. Oh, we've been working with the town of Ankrum to put together kind of their own senior events this summer, which I think is exciting. And then senior day planning underway. And still looking for administrative assistant, community services aide, and after doing the age open. I think that's it for now. Questions? And I didn't talk to Jim directly, but I've connected him to Joyce. So. Perfect. And then our meeting's tonight, so if I don't see him there, I'll reach out and make sure it's received. Good, thank you.
All right, anything else for Director Benvenuto?
Thank you.
Thank you. Slanche, straight from Ireland, all right.
How's everybody?
We're good. How about yourself?
Good. Got a couple of questions here. First, asking for authorization to contract with ARC of Columbia, Saratoga.
Do I have a motion?
Parent Place Preschool.
So moved.
Do I have a second?
Yeah.
Further discussion? All in favor?
Yeah.
Aye. Opposed? Carried.
So much.
Well,
Next, hoping to contract with Hope Van Tassel, speech language pathologist to
Move
provide preschool services.
Do I have a second?
second.
Further discussion? All in favor? Aye. Opposed? Carried. I could use a little bit more eyes coming out of the committee. I felt really
Yes.
alone on that one.
It went so fast.
Get used to it.
Requesting.
I'm not castigating, I'm treating.
But yeah.
Requesting authorization for the Director of Children's Special Needs to bid, award, execute, and adjust transportation contracts.
I'll move that.
Do I have a second? Further discussion? All in favor? Aye. Opposed? Carried.
I think this might be my last one. Authorization to carry over funding on multiple grants from 25 to 26.
Move it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
I've got my director's report here from April. Some crazy stuff in foodborne. We got 4 unrelated sugar toxin E. coli's, and they actually all came in 1 week.
Wow.
Like, what is happening?
Yeah.
So a little frightening there. We had, for April, we had 6 hospitalized between RSV and flu.
April.
April, that,
There've been a lot of sick people.
really,
And they're
really
still-
sick.
Still are.
Flu is no longer widespread as of April 23rd. So that is good. it's just been a crazy respiratory season.
Mhm.
And COVID's been the least of it, to be honest, so. It's just. Arthropod is bumping. But you don't need me to tell you that. We're getting engineering plans out, 35, septic system plans were reviewed in April through our contracted entities. 19 approvals were sent.
How many in the queue?
So we're, 2 digits in the queue now, so that's good. We're into the year 2026, so that's also good. But we're working through them.
Oh,
They are complicated.
And the code officer is very appreciative that the flow is there.
Yeah.
They make it much easier just to deal with people when they know that it's flowing.
Yeah, and, you know, we hope to do some more outreach to the code enforcement officers, in the future. Hopefully we get an engineer, in and we can include them in on that, but there just seemed to be a lot of confusion.
Well, just look at the septic that's going in for Dirty Don's Turnpike Inn, if you guys are familiar with on 66, that's a.
Yes, yeah.
It's bigger than your system, it's going in right up there in rural Canada.
What's that gonna be?
Like a tavern.
Yeah, so there's a new sign up there, says
Oh,
coming
that's the
soon,
one in the
Tavern.
corner?
So
Yeah,
they're pumping under the road to these beds across the street.
saw that.
It's huge.
Yeah, it's
I
very,
didn't know that was a septic. I
Dirty
didn't know
Don's,
that.
they had the best pizza and wings in there.
Yeah.
Ever. I used to
And he
take part-
was Dirty
And I
Don.
used to take part in that place, let me tell you. So,
yeah.
it was, yeah, I think I let out, but
I
you
got
had
coffee
nothing to
grinds
worry
in
about, it
there.
was killed, it was dead, it was
Chicken
gone.
wings, because they
It
come
was
in a
good.
can, coffee can.
Pizza and wings.
And
God.
And you can still smoke forever.
exactly.
And that back
They
room,
kept, they maintained their smoking room.
They did.
that was grandfather right on there.
I
Well, no
digress, I'm
more.
sorry.
I've never heard it called that. Now I
Dirty
do.
Don.
It's
Oh,
such an
yeah.
insider.
Things are more kids, right?
And I will just, highlight too, you know, the health department, monitors the Sharps kiosks. They're located at the Hannaford and Valatia, Livingston. There's one at HPD. We've been having some trouble with, people jamming things in there. There are more people on injectables than ever.
Right.
You know,
Yeah.
so a lot of home generated Sharps, we're seeing increases. We're working on some alternative education because people are putting loose needles in there and, you know, our guys are cleaning them up, and transporting them to our partner facilities. So that's, an issue that we're addressing too. And I just, last month I had brought the annual report to you for 2025. And I was wondering if I could get the green light to start promoting that.
Everyone's had a chance to review? All right, I'm gonna ask for a motion to approve the 2025 report.
I'll move it.
Second.
Further discussion? Thank you very much, Director. All in favor? Aye. Opposed? Carried.
Any other questions on anything at all?
I have one.
Randy.
What can you say about the ticks?
That's what I was just.
They're unbelievable.
Yeah. And it's not
I'm seeing
unexpected.
Lyme disease population.
So Lyme disease is the least of it, to be honest with you. Anaplasma, babesia, you know, the new ones that they're talking about, those are the ones that they, you know, don't have a rash or anything associated with them that could indicate or make diagnosis easier. But yeah, it's not unexpected. You'd think that the brutal winter we had and the cold and the snow would have taken care of them, but actually the amount of snow created like an insular level to them. So it actually helped preserve them. So you can't win, really, can you?
I asked for selfish reasons. I pulled 2 out of me in 2 days. So, okay, great.
Yeah, you know, get in touch with your medical, they might put you on prophylaxis, just, you know, a couple of days of
Okay.
vaccine.
The other down here.
But it will depend on what your provider wants to do. But yeah,
I think it's 2 for the one day, because I can't remember, it was a couple of years ago, and my doctor had sent them to me because I had, you know, the dog, pulled them off. I had one crawling on my wall in my house day before yesterday. I had one here, and then next I had another one here. It's, yeah, just crawling. I said, oh, come on.
At the Board of Health meeting, you did mention the potential cessation of funding that we use for our migrant outreach clinics. Is that something we need to be preparing for as budget time comes upon us?
So I have a meeting scheduled in early June with the Office of Human Rights and Health Equity to discuss that decision. And based on what they share with me, I plan to figure out a way to ensure continuity of services for our migrant population.
Correct.
However that looks, but it is likely that I will be asking for support on that. It is just a little bit premature in that discussion.
I hope I didn't preempt you in any
Yeah,
way,
not at
but
all.
I just want to address that because it's definitely something I feel the county should.
Certainly. And I know some of my colleagues might be seeing this also. It seems that some of the funding from the state is becoming regionalized. And I think that that's what's happening here. Unfortunately, in, rural areas, when they regionalize certain funding lines,
Yeah.
the people who could have more fruit farmers that, it's going somewhere. So we'll just have to get to the bottom. My plan is to get to the bottom of it before I start, asking for things.
Thank you, Director. All righty then. Last but not least, social services.
God
Commissioner
never
Dixon.
goes last.
Yes.
Never.
His backstory.
Yeah, okay. Yeah.
Yeah, it's a savant named Melissa Sheriff. Get her stuff in there.
Okay, first request is to abolish one senior social services investigator position at a grade 14, and then create and fill one social services investigator position at a grade 12A.
Do I have a second? Further discussion? Similar services, less expense, easier fillable.
All of those things, yeah.
Yeah.
All in favor?
Aye.
Opposed? Carried.
Okay, request authorization to fill one caseworker assistant position.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Third, request authorization to fill one full-time transportation aide.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Number 4 here has been part of a larger plan as we restructure our business office. I'll be happy to answer any questions if they do come up. Requesting to abolish one account clerk position, which is at grade 10C, and to create and fill one bookkeeper position at a grade 12A.
Happy to contribute to greater efficiency at lower costs.
Yes. So that's her motion? My
Yes.
second. There you go.
And this one isn't necessarily
Well,
lower
So
cost.
it's part of a restructure and the
Yes.
entire group.
It's systemic. Yes.
Right.
I get you.
I heard it. Framed it well, though.
Well done, well done. And point 1 is tracking on
Yep.
it. They've helped me kind of work through that. So ultimately it is a cost savings and more efficiency.
So I had a motion in a second. on that.
You did.
All in favor?
Aye.
Opposed? Carried.
Okay, request authorization to fill one principal social welfare examiner position, which is currently operating under an emergency fill.
I'll move that.
Do I have a second?
Second.
Nice to see the vacancies staying in the house, so. All in favor? Aye. Opposed? Carried.
And will that be a permanent bill? I know it's an emergency.
It will be a permanent, and that person took the trainer position.
Okay.
Vital to our new plan. All right, now request to enter into a contract with Repeat Business Systems for the use of a printer copier. So we're going in a new direction here that we think it'll be much more cost effective than continuing to try to make it work with some of these clunky old printers. It's the advice we got to take
We use them.
Looks like a pretty good idea to me.
We all have them.
We're going.
Yeah.
Have we all seen the Major Motion Picture Office Space where they had that cathartic moment where they dragged the printer out into the field? Seen that? Nobody?
I've seen it. I'd like to do it.
I'll second it.
All in favor?
Aye.
Opposed? Carried.
Okay, and number 7, request to amend, previous, authorization to create 2 civil service positions that were incorrectly titled.
Those were adding the trainer.
Yeah.
I'll move it.
Do I have a second? Further discussion? All in favor? Aye. Opposed? Carried.
All right, so there's my numbers. I don't have a whole lot to say. I do want to update this committee though. Some were copied on an email that I sent last week. As you know, as you all know, Kathy, you would certainly know this. I've taken a lot of meetings over the last couple of years regarding the climbing of the homeless numbers. And some people approach me because they're aware of our relationship vis-a-vis Bard College now, but was Galvin Resources then. What we did in order to bring better services and that to the homeless population, and that because that comes because you're able to give pretty intensive services to it. So, you know, that's great. And that was there because there was not a tier 2 shelter. So we were always operating out of a motel, and that's, you know, it's certainly proven a success. We had another hotel operator that's approached me and said, well, I'm kind of interested in that too. I mean, he already does business with the county, but he might be interested in that. So we take a meeting, we discuss these things. Somebody is with a property over on Healy Boulevard is interested. So, and they came and spoke here at a Health and Human Services meeting, which I thought, you know, they were pretty clear on their intentions and they're moving forward. I don't know what they are in the process with Greenport, but certainly have talked to us about what's it look like when we do get there, what is it that you need, how does security get that. I bring all that up because I'm willing to discuss at any time with anyone that are out there. And I don't think that I keep that intent close to my chest. I often share it with supervisors. I come here and, you know, there's this feeling out in the community that I should limit my prospects for my clients to, you know, talking to just a few providers or not opening up that discussion to a lot of people. And I don't feel that way, but I want to put it to the whole committee. I think it should be, I'll have these conversations, I'll bring it to the board. If the board seems like they want it to go forward, if my folks feel like it's something that can benefit them, we'll have that further discussion. If not, we'll move on from it. But I don't really want to limit what options are out there. So that was the purpose of me copying as many folks as I could think of on the home committee to my response. I stand by that. And I'll say what I say to everyone. You can see the numbers. My goal isn't to continue to create emergency housing. I know I need it. But that is not my goal. My goal is to shrink that number and have permanent housing. And that I really have to look to the towns and to the county to say, you know, whatever will facilitate that. That continues to be my goal. I think that over the last several months, I've been able to get that number to where it is. It might seem very large to someone who just walked in, and I would understand that. Certainly, if you haven't been here in 10 years, that would seem like a large number. Of course, if you've been here between 2019 and 2024, you'd say, oh, what's happening? Those numbers are going down quite a bit. And I don't exactly know why that is just yet, but I am looking at it closely. But the goal continues to be to at least cut that 90 in half, if not more. And I'm not really gonna stop for that because. So, are there any questions on that?
I don't have a question. I did read your email and I appreciate your sending it because we'd had several of those conversations. But I do think that it may be difficult for someone who's not doing this every day to appreciate the scarcity of rooms and the fact that you often don't have a lot of time to find spaces for people. So, I mean, I would characterize part of your work as leaving no stone unturned to make sure that we can get people in rooms when they need them. So I really appreciate the fact that you keep the list flexible and the list open, because we know that there are a number of people, including one of the people you and I've talked about, that have indicated an interest, but they've never stepped up and done the work.
Sure.
So we don't know eventually who is going to step up and do the work. And I realize that it makes more work for you, but I hope you know that we appreciate your efforts on our behalf.
Well, I absolutely do, and I don't mind the more work. I'm just saying, without options, we don't get anywhere.
Right.
All right. Well,
I just don't know about that, but and just because I'm new this year, but now that we have 4 months in there, like, they're like, you know, a lot of caseworker vacancies, right? Like 8 to 10. So I just want to know if that's been consistent also, like, over the last several years, or just like what the impact that has. And I'm sure it does that mean like longer wait times to get, you know, a case?
Well,
developed?
I'll
Just
tell
like-
you, it has led to higher case rates. We remain ahead of the curve on opening cases. That's a credit to my staff.
Mhm.
If you look around the county, and that is, actually, those are numbers I can provide, and I will bring them next time. We are ahead of the curve. There are a lot of counties, understandably behind the curve, and it is staffing. My folks will stay on leave. My folks will come in on Saturdays. My folks will, they won't admit it, but they'll skip breaks.
Right.
They'll do these things because they're very
Right.
conscious of the numbers. Supervisor, you were here a number of years ago, and indeed, the inception of this took place before I was at DSS,
Mm.
but the county got sued.
We need a Heimlich for the White Wizard. You have my permission to vacate the committee meeting.
As long as
Yeah.
it's coughing, he's fine.
Sorry to interrupt.
That's okay. We got sued,
Okay.
and so did many counties in the state get sued. And as it turns out, and as they learned, you know, the lawsuit isn't gonna change anything.
Right.
That's not gonna do anything. What's gonna do good is we get staffed up, we get some practices changed, we get some help. We get some help from the state. All those things took place and we've taken off. Is it tough? It's very tough. But as everybody on this committee who has been doing it, this has been going on for about close to 5 years. We're slowly coming out of the woods. Also, we've learned that maybe we can consolidate a little bit here. And if we can consolidate, what do we want to do if that means savings, to the county? Do we want to do some of the things like restructure like we've been doing? Yeah, sometimes we do. We get better. Sometimes we just save money. Sometimes we just want to keep finding caseworkers. We are still looking,
Right.
and it does matter.
Yeah, and then people get burned out.
We are still higher.
Yeah.
But if you look at the total vacancies, that number's been pretty flat for 3 years, 4 years
Yeah,
since
that's
COVID.
That's why I
Yeah.
asked, yeah.
Right. It's also the number of people who are available to fill those jobs.
Yeah.
Whether we're paying it to pay, it's 100 things,
Yeah.
but
Uh,
we haven't fallen further behind, is what I'm saying.
We have not. The county's actually looking at that now. We're comparing our exit interviews across the board. We're trying to, what might up retention is, to me, that's really where I want to up our game is
Yeah.
retention. Because the more experience, the less you feel.
Yeah.
when you have a vacancy. So,
But did we just address that with those reclassified trainer positions? Are they the ones?
Yeah,
that
we
get
did.
Early
We
entry
did.
staff support?
Yeah, so you get better training up front. You get better training, even if you're a 2 or 3 year vet. There's support there for you. Quite frankly, I go around now once every month, every quarter and say, don't look at the numbers. Okay, I'm not interested in the numbers, but by the way, you're ahead of the curve. You're still on top 10% of the state, and that's a good thing. They see it as, yeah, but it's not what we were. That's not where we were. I love that.
Or not,
As a competitor, I love that attitude.
or even better, not where we want to be.
And it's not where we want to be, but we're pleased with your effort. So that goes, I think, a long way towards retention. We're going to do a staff development day in the fall, an entire day where we'll bring, we take some course material from the state, but we also mix in a lot of, it's just, it's a staff development day. You're gonna eat some good food. You're gonna play some trivia games as well. All the things you try to do to get people convinced that, hey, this is the place to be, because the state's my biggest competitor. And they don't mind putting, this is a public record, so I don't mind making one. They go to the state and they do less for our people, not more for them. They do less for our people. And I know that because some come back. So I'll leave it at that.
Thank you.
Thank you. Thanks, folks.
Thank you, sir. When is the youth appreciation dinner?
That is Wednesday, tomorrow.
Tomorrow night.
Hope to see you.
So, yes,
I'll be there.
I know you'll be.
straight from Public Works to that, huh? All right. Is there anything else from the committee?
I won't be at the.
Is there anything from the public? You feeling better? All right.
Gotta keep coughing.
What time you gotta be here?
I'm gonna ask for a motion to adjourn.
So moved.
Do I have a second?
We gotta get there.
All in favor? Aye. Opposed? Good night, everybody.
Okay, I'd like to call the public safety meeting together for Tuesday, May 19th, 2026. First up, we have the DA would like to make an introduction.
Yeah, thank you. Sorry to jump the agenda, everybody,
worries.
but I just wanted to introduce my new confidential administrator, Inez LeBrook. Did I pronounce that properly?
Hi.
All right. She is a primary point of contact for my office. She's been with us maybe 3 weeks now. She's doing a great job. I have every faith in her. So if I don't respond to something, she's the person to ask why I haven't responded. And if it's not on her calendar, it's not on my calendar. So just wanted to make sure everybody gets a chance to meet her. And
Welcome.
I sent earlier today for the committee's information. I finally sent the 2025 year-end report, just sent. So I believe that'll probably go out to everybody shortly, and then I'll be prepared to discuss it if anybody has questions at the next meeting.
Very good.
Great.
So I have, and now I have to go to Chatham to do cemetery cleanup at the Cub Scouts.
Oh, have fun.
Thank
So,
you.
Thank you.
everyone.
Thank you, sir,
Thank
and welcome.
Bye, Inez.
Nice to meet you.
Okay, next on the agenda, we have conflict defender. Important.
Hello, everybody.
That's a good thing Mark has an assistant. First, you got to go first. She got your
There you
information.
go.
I helped you.
Yeah, yeah. I know the secret is,
until today that was a perk of getting it done.
it is, the secret is that earlier you get it in, your boss can be on the agenda. So
I like it.
if you procrastinate,
Which is why I'm usually in the line.
and
We are requesting to fill a retirement vacancy and also a emergency fill for that position.
move it.
Second. Have a motion and a second. All in favor?
Aye.
Opposed? Carried.
Thank you. Thank you.
Thank you.
All right, next on the agenda, we have emergency management.
Thank
Mr. Harrison?
Deputy Chairman.
He is. He's chairman today, though.
I'm chair today. I'm in a chair. Might not get up. so.
I don't have much. We submitted our annual report last month, and if you have any questions on that, we did have a multi-agency meeting last week. The chairman attended because ultimately he has responsibility for emergency management in the county and has done a great job. We're doing a 5-year update of our comprehensive emergency management plan. There's no set time limit, and we started it before COVID. Of course, everything else we had to update. We had the jurisdictional hazard mitigation plan that we had to get done. This is kind of easier, doesn't change too much, but we did add some stuff. So we had a big meeting on that. That was required to put it out for input from multiple agencies, Cornell, both public, private, and government agencies. And we did that. So that's complete. We'll be posting that on our website. Well, I'm on the line on whether I'm going to post it. If anybody wants a copy of it, I'll send it. But nowadays, it's not confidential per se. The attachments, like the mass fatality plans and the offshoots of this plan are, and we're not going to send those out. But if anybody wants a copy, I probably will, because it just has basic information on how we operate. And I just don't know. I might be going a little overboard with that, but I just don't want to put it out there. It's too easy.
Don't want everybody to find the workarounds.
Well, yeah. I mean, I'm not too worried about it, but worried enough. So, any questions?
Any questions for the director?
I told everybody I go easy.
Anything? No.
Nothing on you.
Yes, I did. Yes, I did. Thank you.
Annual report. Is annual report from last month?
Yes.
What's
I'll
that?
make a motion, we approve his annual report.
Second.
Motion and a second to approve the annual report. Any discussion? My brain is fried, I'm sorry. All in favor? Opposed? Carried. Thank you, sir. Okay. Next up, we have probation.
Afternoon.
Good afternoon.
We have one general resolution authorized to accept a grant from DCJ.
Second.
I didn't even see Grant. All in favor? Any opposed? Take your money.
Except the grant.
I didn't even see Grant. If I had seen Grant, I saw it earlier in the agenda, but. All right, next up, we have Sheriff. Good
I got
afternoon.
one, sorry, good afternoon. All right. Quite a few. Yep. We had a deputy resign, and we'd love to fill that position. Authorization. Second.
A motion and a second, all in favor?
Aye.
Opposed? Carried.
We had another deputy retire, and authorization to fill that position.
A motion and a second, all in favor?
Aye.
Opposed? Carried.
All right. Authorization to fill another position of deputy sheriff. This deputy was promoted to investigator. Move it. Second.
Motion and a second, all in favor?
Aye.
Opposed? Carried.
All right. Another motion to fill a investigator position. We had an investigator retire April 1st.
This is correct.
That's all right.
Corrections officer.
I can skip to that.
I got investigated.
Okay.
Oh, she doesn't know.
Oh, yeah, no, oh,
Go
yeah, go right ahead. Sorry.
Skip to investigator.
We'll go down, we'll go back
All
up.
right.
It's all right.
All right.
the investigator.
Okay. All right.
I have a motion for the investigator. Do I have a second? Second, all in favor?
Aye.
Opposed? Carried.
Do you have correction officer, Jackie?
I will get to it. I don't think so.
Due to a promotion?
Good stuff.
Yeah.
I got one position, sorry.
Did it get stuck with your?
Here you go.
Yes. Thank you.
Thank Linda.
Thank you.
Brenda comes from there.
That's right.
All right. I would love authorization. One corrections officer position.
Second.
Have a motion and a second, all in favor?
Thank you.
And that did go through point one.
Yeah.
All in favor? Opposed?
Now
Carried.
you have a senior investigator.
Yeah, so
Okay.
this one's a little tricky. So we have, a gentleman out on, disability in the position of senior investigator. And we desperately needed one, so we want to abolish an investigator position and fill a senior investigator position.
A motion?
So basically, you're moving somebody up to that position.
The difference is
You're just gonna abolish.
about $2,000, yeah.
So, second.
A motion and a second, all in favor? Opposed? Carried.
So, right.
And this is authorization to abolish the sergeant communications officer position. And, just have it, a basic communications officer position. And so it's a savings of about $9,000.
A motion, do I have a second?
Yeah, Colleen.
Okay, all in favor? Opposed?
The employee asked to be demoted? Okay.
Alrighty, this is authorization to move monies in the budget, because we're gonna be leasing vehicles rather than purchasing them. Significantly lower cost.
Second.
Have a motion and a second, all in favor? Further discussion? Opposed? Carried.
The next one is to amend the budget again, for insurance monies. We received $6,600.
Second.
Motion and a second, all in favor? Opposed? Carried.
Right, and this is, an authorization to, get extra equipment for a K-9. So with the lease vehicle from Enterprise, it's gonna have the K-9 in it, and we need to do a cage and do a few other things.
Move it.
Second.
Motion and a second, all in favor? Opposed? Carried.
And then I believe this is the last one. We have a vehicle and it's authorization to auction it off as surplus.
Move it.
Surplus.
Motion and a second, all in favor? Opposed? Carried.
And our year-to-date inmate report, 2026, 48,250. Difference of 49,110 from last year. And we have 29 people and only one of those is Green County. I don't still have ours.
Any questions for the sheriff?
Good job for one
Yes, sir.
hand.
Well, you knew Kippy had to have one tonight.
Well, yeah, I thought, you had a lot of people either leaving or something. What's your odds of filling those positions between now and the end of the year? I mean, is there a problem with us getting qualified people to fill these, or are they out there?
No, we have, the problem is, once you take the test and then it takes several months to get the results back, then you do your background, then, you make sure that they, can pass basic physical fitness stuff, which we're working with, and that's where we lost most people. And then we have to find an academy for them to go in, and it's 6 months, and then there's another 6 months. So that's about 2 years
Really?
from the time they take the exam to getting somebody, on the road.
So it's gonna take a while for you to fill.
Yeah, we've not lost anybody to state police of late, and we're grateful for that. And so, if we continue at this rate, then I think we'll be okay. We had 33 people sign up for the last test, which is 100% more than what we've had previously. So there's an interest.
Okay.
Very
Thank you.
Thank you, Sheriff.
Yeah.
Basement stairs. I was gonna give you the exciting story, but it's just.
Oh, no.
Yeah.
I wanna hear it. I don't want the details.
standing there smashing.
Later, yeah.
No, and there's a high-speed chase and it was an epic takedown.
Next up, Mr. Keeler.
My list's a lot shorter than that one. Resolution to, approve a contract with WHP, the manufacturers of our fire train tower, to do their inspection of the facility.
Second.
A motion and a second, all in favor? Opposed? Carried.
And a couple of resolutions for, to appoint a fast team member and a Xeno
Move
code.
that. Second.
The motion is second, all in favor?
Aye.
Perfect, thank you.
Opposed? Carried.
Let me go back to the report here.
That's for year-to-date report. Any questions?
Any questions for Mr. Keeler?
Kippy?
You sure, Kippy?
Just check.
Don't encourage it.
Well, George.
Speak now or forever hold your peace.
Bring it on. I'm fine for this month so far.
We'll wait
I
till
was in
next,
Florida, there you go. Want to wait? Okay. I'll go to Florida.
wait till next month, sir.
You can hold one over here.
I'll see you. He's being nice to the, the deputy chair. He'll wait for Bob to get back. All right, next up, we have 911.
I just have a personnel request to fill one big emergency dispatcher position.
Move it.
Second.
Motion is second. All in favor?
Aye.
Opposed?
Thank you.
Very good. Thank you.
On the back wall.
All right, next up, we have EMS.
All right.
Keeler.
How's everybody?
Doing well, yourself?
You want to keep me saving up for me?
Wow.
And you notice I'm not high up on the agenda, so I get mine in kind of late. But anyway, I just have one resolution request in our continuing effort to kind of improve the quality of EMS in Columbia County here. And following some of the studies that the Fitch Group did for us, one of the recommendations they had, they emphasized the importance of standardized countywide clinical education. So one of the most difficult things that paramedics can do in the field is working with airway management. So I have a resolution request here to contract with Airway Management Education Center for not to exceed $5,500. They will provide all the course content, the material involved. Our countywide medical director, Dr. Stippa, will be involved in teaching this course, and we will be teaching it to every medic in Columbia County. And all the agencies will participate. And it's about 8 to 16 hours of education for each medic. So.
Move it.
Second.
A motion is second. All in favor?
Aye.
Opposed? Any questions?
Oh, no, please.
What is the cost? The county's gonna pay the cost and train the.
Yes, it's in my
different
budget.
EMS, okay,
Yep.
excellent.
And I think we reimburse this group like $50 a person.
But the county's gonna pay it and we're gonna then offer it or require it of all of the EMS providers that the towns contract with.
All the agencies have agreed to send their providers to this course.
Excellent.
And we're going to, as a county, as a group, what we've done historically is reimburse the agency for the hours that they're going to spend in this course.
Okay,
But it'll be standardized training.
and is it staggered so that we're not leaving the agencies without
Yes.
coverage?
It's over the course of 3 or 4 different days.
Okay, awesome.
Yeah, we're not going to take everybody.
Everyone in training, now would be the time. I'm sorry if you
Yeah.
don't have a heart attack.
Hey, PJ, you
Yeah.
didn't have another request, because we had authorization of renew contracts for the PCEMS 2-year period.
That was a couple months ago.
But it says, I think she sent me the wrong one, because it says 5/15/26 with the contract for what you just asked for.
Okay, that's all I need is this contract.
Okay, so we're just doing the one resolution. Thank you.
Yep.
Okay.
I just want to make sure.
Give me the right one and all.
It's fine.
Okay.
Go ahead.
I was
So-
confused by that too, because it said January 20th meeting day.
Yeah,
Sorry about that.
I'll pull that one off the side for you.
yeah.
Treasurer's office is a little busy. So we got to get this into Kelly.
To date, we have 4 ambulance services
Correct.
servicing Columbia County, correct?
Yes.
Do we get information on how well off these ambulance services are? Not financial, I'm talking about people there that are working, how many there is. I mean, we lost the one down there in Livingston because they pulled out. And I don't want to see something all of a sudden we get hit and said that something. Do we know how they are? It's almost the same with the firemen. How well off are they? I mean, we've made in Clover, we've done some change in our fire companies because we weren't well off.
Sure.
But this is more affects the county.
Yep.
So who takes care of all?
Each individual agency supports their own agency as far as personnel goes. I can tell you that most all the agencies are struggling for providers, only from a standpoint of there are not enough providers, okay? But that's one of the advantages that we have within the system, and I'll give you an example whereby one agency may only have a BLS crew on today, but the adjoining agency or in our system, we have extra ALS providers in other areas, so we supplement them. So it's a shared, business.
Do you think we'll be down to 3 eventually?
I'm hoping not.
Hope not.
Work group that the chairman has set up, we are striving to make inroads to try to make sure that that doesn't happen, especially from a financial standpoint.
Yeah, I know we're working on that.
Yeah.
That's a big part, but
Yeah.
I'm saying
Yeah.
personnel is a big part too on anything.
Yes, it is. Yes, I can't
Look, we had to
guarantee,
go to mutual aid with a fireman because we just never had enough guys showing up.
I can't guarantee anything, but we're doing everything we can
Right.
on our part not to let that happen.
Okay.
PJ, along those lines, could I ask, I know there's a great work group and they're active and working. Timeline wise, I assume the work group or you will present to this committee at some point. Are we looking?
We'll
for
present both to the committee
27
and probably
budget?
to the full board. That's our intent.
Okay.
The intent is, we have a meeting this Thursday. And then the following month in June, we will have another meeting, and then probably right after that, present to whatever chairman wants us to, this group or the full board.
So it could be a proposal for 27
Oh, it absolutely will
budget.
be.
That's the goal. Okay, thank you.
Yep.
Questions? Kippy?
I'm good.
No?
For this one.
For this one. Thank you, sir.
Yeah.
And last but not least, public defender. Zoning?
Yes, sir.
Good afternoon, everyone.
Good afternoon.
I have a general resolution request. The chairman to sign a yearly contract, with New York State Defenders Association for the public defender case management system.
Second.
Have a motion and a second. All in favor? Opposed?
And then I have 2 personnel requests, requesting, fill a temporary position for a law enforcement. It's paid out of, money in my budget, and it's a 12-week position.
Move it. Second.
Motion and a second. Any questions? All in favor? Opposed?
And finally, the second personnel resolution request is requesting permission to fill the position of an assistant public defender. This position is, grant funded.
Move it.
Second.
Motion and a second. Where were you, right?
Oh, yeah.
All in favor? Opposed? Carried.
Wonderful. Thank you, everyone.
Of course.
Have a nice night.
Any other questions?
I won't- See you next time. Thank you, John.
Thank you.
Thank you.
Thank you.
Do we have any questions from the committee? Questions from the public? With that, I'll entertain a motion to adjourn.
Moved. Second.
Motion and a second. All in favor?
Aye.
Thank you, everyone.
Did you-